Hi, my name is Adeyemi of the Business Intelligence Analytics Program of Nova Scotia Community College 2020-2021. Today, in my capstone presentation, I'll be analyzing and highlighting the impact of COVID-19 pandemic on select sectors in Canada. This presentation is a summary level presentation, and we would highlight key statistics and trends on the impact of COVID-19 across four sectors. First, I will do an introduction to COVID-19, the impact of COVID-19 geographically. As we can see, the impact of COVID-19 on the map shown above here, per capita, 100,000 per capita across Canada. We can see that Quebec is the most affected, followed by Alberta, and Nova Scotia is one of the least affected. We can also see that per capita 100,000 deaths, Quebec is also the most affected, followed by Ontario. We can also see down here that we are highlighting the numbers of confirmed COVID cases across the world, Canada, and the Atlantic provinces. We are also able to highlight the confirmed deaths across the world, Canada, and the Atlantic province. We can see that COVID-19 has taken close to 3 million lives worldwide, and the impact of COVID-19 has not only been physical in terms of life lost, it has also been financial. You can see that Canada as a whole has spent close to 300 billion in 2020 on the healthcare sector alone. The Atlantic province spending close to 30 billion on healthcare, and Nova Scotia is spending about close to 9 billion on healthcare in 2020. Now we would go on a sector by sector breakdown. The first sector we'll be analyzing is and highlighting key statistics from is the economy and the businesses and the economy sectors. First, on the chart on the left, we can see the five most impacted businesses in sectors in Canada. First is the arts and entertainment. As we all know, movie productions have been on hold, the cinemas are down, and everything. The sports events are almost Indoor sports events are almost put to a hold. Concerts are put to the hold, thus making this sector one of the most affected with about 14%, followed by oil and gas mining at almost 10%, information and culture and information about 8%, other services at about 7.2%, and hospitality, which is the hotels and dining, at about 7.5%. In the next chart, we're able to analyze and show you the percentage of businesses that stayed open and closed in this period. We can see here we are comparing Nova Scotia and Canada, with Canada in green and Nova Scotia in blue. We can see that the Nova Scotia has been able to keep the number of businesses shut down to about 2.6% compared to the national average, which is about 4.3%. Nova Scotia has been able to restart most of its businesses, and we can see that Nova Scotia has been able to keep 46.7% of its businesses fully operational. Compared to the national average, we can see that Nova Scotia has been able to do better. Next, we will be looking at the impact of COVID-19 on transport, air travel specifically, and the 5 major airports. Here, we are doing a year-to-year comparison of revenue earned by these airports. And in 2020, we can see a 40% reduction in revenue across airports. This is a very drastic reduction due to COVID-19. As we both know, due to border closures and the rest, air travel has really taken a big hit. On the chart on the right is a chart that shows the number of travelers per month. And we can see a sharp drop in March to about less than 1.5 million travelers a month in Canada due to COVID-19. And we can see this has stayed around that level of about less than 3 million since then. We can see that the travel sector is one of the most hit sectors worldwide. Next is the healthcare expenditure. On the chart on the left shows the year-to-year comparison of healthcare spend per capita in Nova Scotia and Canada as a whole. And we can see in 2020 that there has been a giant leap, and healthcare spend has gone up by almost $1,000 in Nova Scotia and more than $750 in the other parts of Canada. This is a big change compared to the less than $200 change per month per year in the previous years. We can also see the change in the total healthcare budget of Canada. We can see that in 2020 there has been a sharp increase to almost 10% compared to the national average of about 4% increase per year. As we can see, this is a huge jump of almost 6%. On the next tab, we'll be highlighting the mortality statistics. The first chart shows us a comparison between COVID-19 deaths and unexpected deaths. In the beginning, we were able to see that COVID-19 deaths were about equal to the unexpected deaths, and then going forward, we realized that unexpected deaths, that's unpredicted deaths, had gone up and the COVID-19 deaths had reduced. And then later in the year, we can see that statistics are started to match again. Obviously, people are dying from other causes of illnesses that were not previously predicted. Here we are also analyzing the top 5 causes of death in Canada in 2019 and 2020. We can see cancer, other causes of death, car accidents, and influenzas and unintentional harm have made up the top 5 in 2019, while in 2020, COVID-19 has crept into the top 4 and pushing influenza to number 5. We can also see here that the unintentional harm has reduced by at least a percentage point per 100,000 people in Canada and Nova Scotia as a whole. This is, a reasonable reduction of about even across Canada. We can see the national deaths from suicide has gone down by more than 50% across Canada and more than 20% in Nova Scotia alone, which is great. Now, my references for this project was taken from the COVID-19 Bing data, and we used the data to create the cases per capita and the daily cases, and also we got data from the Canadian Institute of Health Information to verify the health spend, and the rest from Statistics Canada. Thank you very much. I hope you found this presentation very useful today. Do have a great day.